When you live on a fixed income, even a small increase in your monthly expenses can feel like a big problem. Now imagine opening your Medicare statement in 2026 and realizing your premiums have gone up again. For millions of retirees across the United States, that possibility is becoming a serious concern. Because something unusual may be happening in 2026, what some analysts are already calling a potential big spike in Medicare premiums. And if you rely on Medicare and Social Security to manage your retirement budget, this is something you absolutely need to understand. In today's video, we're going to break down what's behind the potential premium increases, why Medicare costs sometimes jump suddenly, and most importantly, what retirees should be watching closely right now. Quick reminder before we begin, this video is for educational purposes only and should not be considered personal financial or insurance advice. Medicare rules can change and every situation is different, so always verify details with Medicare or a licensed advisor. But understanding what could be coming can help you prepare instead of being surprised later. Let's start with the question many seniors are asking right now. Why could Medicare premiums spike in 2026? To understand that, we first need to talk about how Medicare premiums are actually calculated. Most retirees know that Medicare Part A is usually premium-free if you worked and paid Medicare taxes long enough. But Part B, which covers doctor visits and outpatient services, does have a monthly premium. In recent years, that premium has increased almost every year. Sometimes the increases are small. But occasionally there are years when the increases are much larger than expected. And those are the years that can really affect retirees living on fixed incomes. One reason premiums can increase sharply is the cost of healthcare itself. Medicare spends billions of dollars each year paying hospitals, doctors, and healthcare providers. When healthcare costs rise, Medicare spending rises as well. And when spending rises, premiums often follow. Another factor that can drive sudden increases is the cost of new medications and treatments. Over the past few years, some of the most expensive drugs covered by Medicare have been specialty medications, especially treatments for conditions like Alzheimer's disease, cancer, and certain autoimmune disorders. Some of these drugs can cost tens of thousands of dollars per patient every year. When Medicare begins covering new expensive treatments, the program has to adjust its financial projections. That can eventually show up in premiums. And that's one reason analysts sometimes warn about possible premium spikes. Now, another thing retirees should understand is that the standard Medicare Part B premium is not always what everyone pays. Higher-income retirees may pay more because of something called IRMAA, the income-related monthly adjustment amount. This is a surcharge added to your Medicare Part B and Part D premiums if your income is above certain levels. And what surprises many people is that IRMAA looks at your income from 2 years earlier. So your 2026 Medicare premiums could be based on your 2024 tax return. If your income was higher that year because of something like a retirement account withdrawal, selling property, or a one-time investment gain, you could end up paying higher Medicare premiums even if your income later drops. For some retirees, these surcharges can add hundreds of dollars per month to their Medicare costs. And that's why understanding how income affects Medicare premiums is so important. Now let's talk about why some experts are worried about 2026 specifically. Medicare spending is influenced by several things happening at the same time. Healthcare inflation, new treatments, changes in enrollment, and the aging of the population itself. Every day, thousands of Americans reach Medicare eligibility age. As more people enroll, the program grows larger and more complex. When enrollment rises, the financial pressure on the system also increases. And that can lead to adjustments in premiums. But the biggest concern analysts sometimes point to is when multiple cost pressures happen in the same year. If healthcare costs rise significantly, if new expensive drugs enter coverage, and if enrollment continues growing quickly, those factors together can create what some call a premium shock. That's the kind of situation people are worried about when they mention a possible big spike. Now, it's important to understand that not every prediction becomes reality. Medicare premiums are announced each year by the federal government, usually in the fall. Until that announcement happens, the exact numbers are not final. But watching the trends can give retirees time to prepare. And preparation is incredibly important when you're living on a fixed income. For many retirees, Social Security provides the majority of their monthly income. And while Social Security often includes cost of living adjustments, those adjustments don't always fully offset rising healthcare costs. That means when Medicare premiums rise faster than Social Security benefits, retirees can feel the squeeze. There is something called the hold harmless rule that protects many Social Security beneficiaries from having their Medicare Part B premium increase by more than the increase in their Social Security benefit. But not everyone qualifies for that protection. People who enroll in Medicare for the first time. People with higher incomes. Or people who don't yet collect Social Security benefits may not be protected by the hold harmless rule. And those groups could see the full impact of premium increases. That's why staying informed matters. Another thing retirees should remember is that Medicare Advantage plans can also change their premiums, benefits, and networks each year. These plans are offered by private insurance companies approved by Medicare. Some Medicare Advantage plans have very low premiums or even $0 premiums. But their costs and coverage can change annually. Doctor networks can change. Drug formularies can change. Copays and out-of-pocket limits can change. That's why reviewing your plan every year during the Medicare annual enrollment period is so important. Even if you were happy with your plan last year, it doesn't guarantee it will be the best option next year. And if healthcare costs are rising across the system, those changes may show up in plan adjustments. Now here's something many retirees overlook. Your healthcare decisions before retirement can sometimes affect your Medicare costs later. For example, how you withdraw money from retirement accounts can affect your taxable income. And that taxable income can affect whether you pay IRMAA surcharges. Some retirees accidentally push themselves into higher Medicare premium brackets because of large withdrawals from retirement accounts. That's why many financial planners talk about tax-efficient withdrawal strategies in retirement. The goal is not just to manage taxes, but also to manage Medicare costs. Again, this is something that varies from person to person, which is why professional guidance can be valuable. But awareness is the first step. Now let's talk about something positive. Even when Medicare premiums rise, there are still ways retirees can manage their healthcare costs. Reviewing plan options annually. Checking prescription drug coverage. Making sure your doctors are still in network. Comparing Medicare Advantage and original Medicare options. These simple steps can sometimes save retirees hundreds or even thousands of dollars per year. Healthcare decisions during retirement should never be automatic. They should be reviewed carefully every year. And when there are warnings about potential premium spikes, those reviews become even more important. Because when you live on a fixed income, preparation is everything. No one wants to be surprised by a sudden increase in their monthly expenses. The goal is to stay informed, ask questions, and make decisions that protect your financial stability. If you rely on Medicare and Social Security during retirement, staying updated about changes like these can make a real difference. And small adjustments today can prevent big financial headaches tomorrow. If you found this information helpful, consider subscribing to the channel. We regularly discuss Medicare updates, Social Security changes, and retirement issues that affect millions of seniors across the United States. And if you know someone who depends on Medicare, consider sharing this video with them. Because the more people understand how these systems work, the better prepared they'll be for the future. Your retirement income deserves protection. And staying informed is one of the most powerful tools you have. I'll see you in the next video.